Hey, this is Sable, your bougie girlfriend, and now today we're talking about healthcare and why healthcare is so important in your plan of retire to relocate. Healthcare is, I don't even know how to express how important this is, especially when you're moving to another country. Do not take it for granted. Do not make any assumptions in this area because it's way too important, especially as we're talking about people who are into retirement, as you're aging. There's so many things you want to look at. So I'm not going to go into really a lot of detail around assisted living or nursing home, but I am going to tell you to start thinking about the healthcare system from an aging perspective, right? Because as you age, there are a lot of illnesses that you may have that you didn't even know that you had that are starting to come about. Do they have a healthcare system that is going to support you? Are you able to buy health insurance? Are you able to use any of your health insurance that you have in your country? Are you able to transfer that into another country? That is something that you want to consider. Do they have skilled doctors and nurses? Are you able to assess? Do they have ambulance service that can pick you up if you have an emergency? When I say that you should not just take it for granted, it's not because I'm just like guessing, it's what I've experienced. I remember walking one day into a doctor's office with a child having an asthma attack, and that doctor would not see that child until we could produce the cash for that child services, for the doctor services. Well, at that time, ATMs were not available. We did not have the cash, and we had no way at 9 o'clock at night to get the money. Finally, the doctor did see us, but it was a struggle. So you want to understand what that system is. Is it a cash-based system? Do you have to pay cash? Is it a credit? Is it insurance? What is it? Are the doctors there? Are they skilled? This is a country that's actually going to get medical supplies. Are they having medical supplies that are dated? Have they expired? All those kind of things you want to look at. I've lived in countries where having drug supplies, just basic medication, was not available. There's a lot of counterfeits that were circulating in the country. So these are the things that you really want to look into. You want to make sure there's a good healthcare system. You want to make sure that you can go into a place and get the healthcare that you needed. You also want to make sure that there's specialists. So if you're a person who is relocating and you have a chronic illness, you want to, before you even think about getting your visa, your residency, do they have the specialist that you need for your chronic disease? Whatever it is, you want to go and see that specialist. You want to engage with that specialist. Now, I do know that the embassies also, you can go to the American embassy and they will give you a list of, not necessarily preferred, but these are people kind of, I don't even want to say that they're recommended, but they do have a list, because I've used that list in some countries, and I'm telling you, I'm not really sure if they recommended those people, because once I got the services, it wasn't really that great. So that's when you want to tap into your international community and see who they're also using and what their recommendations are. So again, please do not take healthcare for granted. Don't make any assumptions. Medications can be very limited till you can go into other countries. Skills could be very limited as you go into other countries. Bedside manners are totally different as you go into other countries, as they're how we treat people in the different services and how we supply and handling is not necessarily what you're going to meet in other countries. So you want to be totally aware of the healthcare systems. Some countries, like I know for sure in Panama, you can use your Medicare card. You may have insurance that also could be used in other countries. So please do your homework on this. You can skip on some other areas. Don't skip on your healthcare. All right. Continue to live an elevated life.